Dear learners, welcome to this audio video on the unit 35 of our course, Sociology of Health and Illness. In this unit, we will discuss about the various settings of medical and psychiatric social work. Dear learners, a medical and psychiatric social work is a specialized discipline of social work. The primary essence of psychiatric social work is to help the people with psychiatric illnesses and also their family members. It basically deals with understanding the social, environmental factors related to the person with psychiatric illness in order to manage them effectively. For this, proper training is required to acquire certain skills to work with the targeted population. These social workers work closely in association with other team members, which includes the psychiatrist, clinical psychologist, psychiatric nurses, occupational therapist, speech therapist, etc. The psychiatric social workers have a wide range of roles and responsibilities at the individual level, group level, family level, as well as at the community level. Using the core methods of social work, adhering to the principles, psychiatric social workers act as a therapist, counselors, educators, advocates, and facilitators. Now let us discuss about different settings of medical and psychiatric social work. First is medical and clinical setting. A general medical hospital consists of different units, and a psychiatric unit is one of them. These are the main training centers for providing postgraduate courses in different disciplines, including psychiatry and allied health sciences. In a psychiatric unit, psychiatric social workers play a crucial role in working with patients, their family members, and the community along with the treatment team. A psychiatric unit in a general medical hospital in India is a major provider of medical health services. In the general medical hospital, a psychiatric social worker performs different responsibilities in order to provide care and support to the people in need. Some of these responsibilities are, first of all, psychosocial assessment. A detailed psychosocial assessment of the person with illness is done by a psychiatric social worker. This assessment is based on domains related to physical, psychological, and social aspects of the person. Familial and societal components also needs to be assessed in psychosocial assessment. Then comes individual therapy. Individual therapy is to be planned prior to the session according to the needs and problems of the individual. Psychoeducation, insight orientation, behavioral therapies, cognitive therapies, stress reduction, motivational enhancement therapy, etc. can be provided at an individual level. Then comes group therapy. Group therapy is a therapy that is provided in a group setting that includes two or more than two people. A proper sequence of the topic to be discussed should be planned prior to the session. Then comes home visits. Making home visits is another responsibility that a psychiatric social worker has to take care of. They visit homes of the people concerned for different purposes like assessment of the psychosocial condition of the family or providing home-based therapeutic services. Then comes family therapy. Psychiatric social workers does not only work with the individual person but also with the family. Family therapy can be provided if there is any issue being faced by the family members. These issues can be marital, parental, or any other related problem. Then comes admission and discharge procedure. A psychiatric social worker also takes care of admission and discharge procedure of the patients. They provide admission counseling in order to educate them about the recommended treatment plan and the rules and regulations of the hospital. They also provide discharge counseling to educate them about the follow-ups, importance of medications and therapies, etc. Health administration is another setting of medical and psychiatric social workers. The World Health Organization defines the health system as the sum total of all the organizations, institutions, and resources whose primary purpose is to improve health. The health system must be of a good quality, easily accessible, and affordable to the targeted population. To provide quality healthcare service, it is important to have a strong health administration in the country. In India, the state is largely responsible for the delivery of healthcare to the people. Each state has its own healthcare delivery system. The center is responsible for planning, assisting, policy making, and coordinating with the state health ministries. In India, health administration is governed at 4 levels. First is the national or the central level. The 3 organs of the healthcare system at the national level are the Ministry of Health and Family Welfare, the Directorate General of Health Services, and the Central Council of Health and Family Welfare. At the state level, the state governments have the full power and autonomy to deal with health matters of the state. Some of the functions of the state are to execute policies and programs in the state, to review and modify and outline policies if required, to coordinate with other state governments and central government, and to ensure smooth and effective functioning of healthcare services. Then comes the district level. The chief medical and health officers and other medical officers are primary in the district level administration. They are in charge of implementation and monitoring of the policies and action plans, and communication management in terms of progress or problems faced. Then comes the community level. At the community level, community health centers provide basic services related to general medicine, gynecology, pediatric, surgery, etc. They provide 24-hour service to the community. Now, the important fact is that in all the 4 levels that we have discussed, a psychiatric social worker plays different roles and responsibilities. At the national or central level, they collaborate in policy making and licensing work. A psychiatric social worker at the state level and district level works directly with the community and people in need. They provide therapeutic services at the individual level, group level, and at the community level. Another setting of the medical and psychiatric social workers is the child daycare centers. Children are considered as one of the marginalized section of the society in India. The government of India has been taking various initiatives to promote child development in the country. There are various non-governmental organizations too working for them. Children may face many problems right from their families to their schools and communities. A daycare center can help the children to come out of their normal routine life for some period of time. A social worker has to play a key role in providing care and support to not only the children but also the family members and the community as a whole. A child daycare center should take care of the safety and security of the children attending the daycare center. A medical and psychiatric social worker has different roles to play in different types of daycare center. These care homes can be regular creche homes or foster care homes or even juvenile care homes, etc. The role of a medical and psychiatric social worker may vary according to the type of the care home. Some of the roles played by the medical and psychiatric social workers in this setting are educating the children about different topics like importance of taking care of one's health and hygiene, ways to take care of one's physical and mental health, how to keep themselves aware of the environment, etc. Then, educating the families of the children about the importance of a healthy parent-child relationship, parent management training, parenting skills, etc. can be provided to the parents in order to help them manage the child at home. If the child has any kind of illness, be it physical or psychological, the parents or the caregivers should be made aware of the illness and the condition of the child. Other aspects like treatment, prognosis, other services, etc. should be discussed with the parents or the caregivers. If a child is in a juvenile care center, then it is important to make them understand the reason they are there, so that they can come to a positive state of mind where they can decide on what they should do and what they should not. It is important to make them aware and strengthen their capacities even during the time period in the care home. Being a professional, a medical and psychiatric social worker should conduct child health and mental health awareness in the community. This will reduce myths and misconceptions related to mental health among the community members. Working on behavioral issues of the children is also important, as we often see that children face a lot of behavioral problems at an early phase of their lives. But the reason may vary from children to children. It may be because of parental upbringing, school environment, home environment, peer relationship, parent-child relationship, etc. A detailed assessment of the psychosocial issues of the child is required to plan a proper and effective psychosocial intervention for the child and the other stakeholders related to the child. Then another setting of the medical and psychiatric social workers is the palliative care. The World Health Organization defines palliative care as an approach that improves the quality of the life of patients and their families facing the problem associated with a life-threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems which can be physical, psychosocial or spiritual. The goal of social workers in palliative care is to improve the overall quality of life of not only the patient but also the family members of the patient. The social workers should have adequate knowledge and understanding about the condition of the patient, the physical symptoms, and the difficulties associated with the symptom. Detailed assessment using biopsychosocial approach helps the social worker in analyzing and understanding the condition properly and plan for an effective psychosocial treatment. The assessment should not only include the conditions and the psychosocial issues but also the familiar aspects related to the person. At an individual level, using biopsychosocial approach, a social worker does an assessment of various components. The biological factors include assessment of the symptoms, the nature, family history, progression of the disease, current health situation, any comorbid conditions, etc. Psychological factors include assessment of the impact of the physical condition or the mental status, any triggering factors of stress, assessment of mental health condition, etc. Assessment of social factors include assessment of socioeconomic status, assessment of familial aspects like knowledge and expectation of the family members, employment, availability of resources in the family system, etc. Again, breaking the difficult news is also one of the important roles that a social worker is supposed to play. The social worker introduces the news of illness of the person to the family members. The manner in which the news is provided to the family members is very important to be kept in mind by the social worker, as it may be a shock to the family members after they come to know about the illness. It is also very important to not only work with the patient but also with the caregivers and other family members. It is usually found that the level of depression, burden, and stress is high among the family caregivers due to the roles and responsibilities associated with intensive palliative care for the patient at home. Then comes forensic psychiatry. Social workers in a forensic setting works with cases related to legal issues and litigation. Mullen had defined forensic mental health as an area of specialization in the criminal sphere involves the assessment and treatment of those who are both mentally disordered and whose behavior has led to or could lead to an offense. Some of the duties and responsibilities of a social worker in the forensic setup are: a social worker in this setting has to work with people from other disciplines in a multidisciplinary team. It is important to coordinate with others in order to provide effective treatment to the patient. A social worker has to perform a biopsychosocial assessment of the person who has been referred by the court to avail the treatment services. It is important to gather information regarding the level of social functioning, review the referral information provided by the police and the court to assess the current mental status of the person at a time when the offense was committed. It is also important to identify the needs of the patients and the problem areas in order to formulate a treatment plan with other professionals. A psychiatric social worker provides psychosocial intervention to the patient according to their needs and problems. It is their responsibility to make the patients aware of the offense or the crime that they have committed and the consequence related to it. It may be also seen that the patients may have guilt feelings resulting in stress and burden, which should also be taken care of by a psychiatric social worker by providing the adequate therapeutic services to the person. Other functions of a social worker in a forensic setting are based on policy and program development, advocacy work, and research work. So, dear learners, in this video, we have discussed about the different settings where medical and psychiatric social workers work. Have you met any medical social worker in any of the above mentioned setting? If yes, please do share your experience with us. Thank you.